Hi, I'm Allegra Jaffe, and my co-leader is Edith Huang, and we are the Millennial 50 plus ambassadors of Northern Virginia. And what we do is network, we make friends, and we receive and provide resources to the Northern Virginia community about older adults so that more millennials and the community in general would become advocates for older adults in our lives. And today we're doing a Medicare 101 hosted by the Pro Aging Network. Thank you so much,
Great.
Steve
Thank you so
Gurney.
much,
And
Steve.
we have
And
Lisa
I want to
Humes
give
on the
my
line
thanks
who's
to
going to chat with
Allegra
us
for
about Medicare
helping to
101.
organize this, and of course to the Millennials, 50 plus ambassadors for their time this evening. I also like to thank Steve Gurney for his technical expertise in getting this done for us. So thank you to everybody there. I'd like to go ahead and share my screen beginning. There we go. So tonight I'd like to just talk a little bit about what's included in Medicare, some of the more important rules, regulations, if you will. Happy to share any information or answer questions, especially if it might have a particular situation for yourself or someone that you know that you would like to ask questions about. I'm happy to answer those either tonight or on a one-to-one kind of personal level. Either way is fine. I work for a company called Health Markets, and I'm an independent insurance agent. I have over 30 years of experience in healthcare and been in the insurance industry now for a little over 7 years. The Health Markets Insurance Agency is all across the country. We have over 3,000 agents. They are a large company, so they help to create the appointments and the relationships with the insurance companies. You can see that I'm appointed with a fair amount of different companies. These are some of the ones that I have, but not all. And then also, I'm happy to be a partner with Pathway Homes as a volunteer and through several networking groups, especially the ones that I have mentioned here with Freedom Networking, but also this last one that's called Superior Options for Seniors. It's just a group of people that all market and work with seniors for a variety of different services. My contact information here, but I'll share it again with you later if it's something that you're interested to call or email me about. Oops, sorry about that. So first of all, key terms. Let's start with those. People who have Medicare are actually called Medicare beneficiaries. So from here on forward, I'll call them beneficiaries as well. The premium is what you would pay on a monthly basis to have that coverage, whether it's with Medicare or an additional coverage with a supplement or Advantage plan. Many plans come with deductibles, which would be the amount you pay first before the insurance company starts to share in the cost. A copay or copayment is typically a preset or a fixed amount that you would pay for a service. So if it's $10 copay for the primary care doctor and $40 for a specialist, that would be a copay. As the co-insurance is generally a percentage that you pay for a service. Generally, that kicks in for things like dialysis or perhaps chemotherapy. I'm going to show an example with Joan. So we're going to walk through her journey here in finding out about Medicare. She's 64, turning 65, and she doesn't know a whole lot about Medicare, so she'd like to find that out. She knows that when they turn 65. And it's also for folks who have certain disabilities if you're under 65 years of age. So typically, if you're on Social Security disability for 24 months or more, you can get into the Medicare system. Those with end-stage renal disease, Lou Gehrig's disease, and a couple others are also eligible for it right away. And you receive a card, generally that red, white, and blue card with Medicare. It will have your name on it if you're the beneficiary, and your number, your Medicare beneficiary information number or identifier, as well as Part A and Part B. So what's covered under those things? Let's take a little bit more of a look. So there's Part A, that one covers hospitalization, skilled nursing, and hospice care. Part B would be your doctor visits, lab, x-ray, physical therapy, and durable medical equipment, which includes wheelchairs, walkers, CPAP machines, and that sort of thing. Now, remember the red, white, and blue card had A and B on it. But there's additional. It's called Medicare Advantage and Part D for prescription drug coverage. And we know that Part A and B are known as original Medicare because that's what's on the red, white, and blue card. So let's talk about all the different parts. First of all, for Part A, what do you have to do to be eligible for Part A? Generally, you have to work 40 quarters or 10 years full-time and pay into the Medicare system, and you will have your Medicare Part A at no additional premium for you. You can also qualify under a spousal benefit, or if you're a legal resident of the United States but didn't pay into the system, you're eligible to purchase Medicare Part A. Depends how long you paid in, could be up to the $458 per month. So Medicare Part A has out-of-pocket costs. With hospitalization, when you go in, it's $1,408 deductible on day one, and that would cover you for the first 60 days. Then there's a cost per day after that, and you can clearly see there's some significant out-of-pocket costs. Also covered under Part A is skilled nursing care. It covers up to 100 days of coverage in skilled nursing. For the first 20 days, it's a zero pay because Medicare pays for that. So much like original Medicare, Medicare Advantage plans also have this coverage limit of 100 days for skilled nursing. And if you've already been involved with somebody who's been in such a situation, you know that they always have to pre-authorize those extra days. And they want to move those folks out of skilled nursing in a very timely fashion so that you don't incur any more cost. All right. Now that we know about hospitalization, what about Part B? So with Part B, there are premiums per month that you would pay for Medicare Part B. The base rate is $144.60, and that's what most folks pay. However, if you are considered a high wage income earner, meaning as a single individual, you make more than $87,000 per year, or as a couple, make more than $174,000 per year, you're considered a high wage income earner, and they will charge you an additional amount based on a sliding scale with your income. And it's called Income Related Monthly Adjusted Amount, or IRMA. Now that IRMA charge not only gets assessed for Part B, like boy, but it also gets assessed for prescription drug coverage for Part D. So there would be two places where they might charge an additional amount above the base. Again, if you have questions about that, I have the charts and the appeal forms if you're interested. So the premiums start at the $144. It covers medically necessary services and prevention. Is there out-of-pocket costs with Part B? Of course there is. And what would those be? There's an annual deductible for services you would pay either all up front or in some combination of $198. It is a one-time per year charge. So once it's paid for, you move on to the next step, and Medicare typically picks up 80%, leaving you with 20%. If you go to a doctor that doesn't accept Medicare as payment, they can charge what they call an excess charge, meaning they can charge a higher amount, and Medicare doesn't pay anything for that higher amount. There are some exceptions depending upon the state in which you reside. Now, you can see that there is some significant out-of-pocket costs with both Part A and B. There is no limit and no cap on what those costs could be. So that's why some folks might get some additional coverage either through a Medicare supplement or Medicare Advantage plan. So we know there's some additional things that Medicare doesn't cover. things like acupuncture, although there is a limited amount of acupuncture that now Medicare will cover based on opioid use. That started in 2020. Chiropractic services, again, a very limited piece that chiropractic services are covered under Medicare. Mostly they are not. If you are in a nursing home or long-term care environment, again, they won't cover beyond the 100 days in long-term in skilled nursing, but won't cover anything for long-term care services. They don't cover for dental, hearing, vision. If you're outside the United States, they don't cover for medical costs outside the United States. And of course, we know that Medicare A and B does not cover prescription drug coverage. That comes separately. So let's talk about prescription drugs covered under what they call Part D for drugs, and what kind of expenses would you pay for those. Now, the costs that we talked about earlier that you might face, those are all for medical kind of costs. Prescription drug coverage always separate from the medical cost. So under prescription drugs, in order to qualify for one of those, you have to be at least enrolled in Part A and or Part B to qualify for a standalone prescription drug. You might need to be enrolled in both, especially if you're going for the Medicare Advantage. If you don't enroll in Part D when you're supposed to, then you could face a late enrollment penalty. There's a late enrollment penalty for not only Part D, but also for Part B, like boy. These things are not assessed to you if you're covered under a company plan. Say you're working beyond age 65 and you're covered under your company's plan as the primary insurer, and it's a large company, you won't have to pay that penalty. But if you didn't get the coverage and don't have any other qualified coverage, then you may end up with some sort of a penalty. These penalties can be lifelong, so it's something that you want to be very careful of and very cognizant about. All right, in addition, for prescription drug coverage, we know that they can be either standalone or included as part of a Medicare Advantage plan. Typically apply, they usually have a drug list or a formulary for each and every plan, so matching your medications to the drug list or the formulary that you're thinking about choosing could be very important for you. Premiums for standalone plans range anywhere from under $15 to about $100. Depends on the amount of medication that you take, the type of medication, so forth. I can plug all those things into a calculator and it will tell me which plans cover your medication and give me an idea of the cost of the drugs over the course of the year. So looking at that information might be real important for you. There are different stages of prescription drug coverage. So this is very different from a regular health insurance plan. In Medicare, there are 4 different phases. The first one is a deductible if it applies to you. Then the initial coverage stage where you pay a copay for your medicine. When you get into the coverage gap or donut hole, the copays go away and you pay a percentage. The last stage, called catastrophic, actually drops down the cost of that plan prescription drug cost to you. And then no matter where you end up throughout the year, in January, everybody starts at the beginning and works their way through the system again. So each and every year, you're facing these 4 different phases of prescription coverage. So we talked about a deductible already. I talked about these different stages. Let's take a look at what that might mean or how it looks. In the deductible phase, we know that you would pay 100% of the cost if you have a deductible. Some plans have no deductible. Some might only apply to tiers 2, 3, or 4. Every plan typically has at least 5 tiers of